Hello students, welcome once again to my YouTube channel. And today's topic of the discussion is about the clinical applied anatomy of the parotid gland. So students, this is a very favorite questions where in the most of the professional exams where you are supposed to write about the detailed description of the parotid gland, there you are asked to, at the end of the answer, you are asked and you are supposed to write the clinical and the applied anatomy of the parotid gland. So students, in this video, I'll be discussing the important facts that what needs to be remembered while writing about the clinical or the applied aspect of the gland. So this is very important, and from this exam point of view, these all the types, the clinical and applied aspects, what I'm mentioning, what I'm discussing, these points must be written in the applied part. So students, beginning with, so first it is the parotid swellings. So students, this fact you all might be very well aware that the parotid gland is encased inside a very firm, the superficial lamina, it is very thick and it is strongly adherent to the gland. So since the superficial lamina is very firm and strongly adherent to the gland, what it is happening is it is quite unyielding. So the first clinical aspect, the clinical applied anatomy, it is the parotid swellings. So the parotid swellings, they are very painful because of the unyielding nature of the parotid fascia. So it is because of the unyielding nature or the thick, the unyielding nature of the parotid fascia, the parotid sheath, what is it? It is encased in. It is very strong binding to the parotid gland. So that's why whenever there is a kind of a parotid swelling, it is very painful. Now moving on to the next, that is the mumps. So students, this is a very most common. The most common finding in case of a parotid gland clinical aspect. So mumps, it is actually an infection which is caused by the paramyxovirus. The genus is the paramyxovirus, and it is caused due to a virus which is known as the rubella virus. So mumps, it is a kind of a very painful condition. So it is an infectious disease of the salivary gland, and this infectious disease, what it is going to is that this mumps virus, it has a very strong affinity to the parotid gland. So in case of the mumps, what is going to happen is the viral parotitis, because it is causing the inflammation of the parotid gland. So just because of the inflammation of the parotid gland, there is going to occur parotitis, and the parotitis in case of this viral infection due to mumps, it is mostly what it is going to happen is this kind of a parotitis is not going to suppurate. Means in cases of mumps, the parotid gland there is not going to be any kind of a pus formation, or it is not going to suppurate, and the complications what are very frequently related to it is the pancreatitis and the orchitis. So during the viral infections, mumps, the complications are very important to remember, because it can cause in males, in young children, if in young boys it happens, it can even lead to orchitis, and that can ultimately lead to infertility as well. So finally, the third clinical complication, it is the parotid abscess. So what is happening is that whenever there is an infection of the parotid gland, so the infection to the parotid gland is mostly, it is a retrograde bacterial infection, because as you all know that the parotid gland is having the duct which is called as the Stenson's duct, and it opens in the vestibule of the mouth opposite to the upper maxillary second molar tooth. So the upper second molar tooth, just near to it, the orifice of the Stenson's duct opens. So what is going to happen is, in cases of parotid abscess, the virus is going to enter in a retrograde manner, and this retrograde bacterial infection from the mouth, it enters through the Stenson's duct, and it ultimately reaches to the parotid gland. So thus it can lead to the formation of an abscess whenever this bacterial infection is going to occur. And when looking at how to treat it, so whenever the parotid abscess is treated, it is with the help of a horizontal incision. Why? Because vertical incision is absolutely not done, just because it can cause injury to the branches of the facial nerve. So whatever the branches of the facial nerve, if a vertical incision is given in case of a parotid abscess, what it is going to happen is it can cause damage or injury to the branches of the facial nerve. So third was parotid ectomy. Now the next important point, it is the mixed parotid tumor. And in this mixed parotid tumor, it is mostly a benign, lobulated, painless tumor, and mostly in cases of mixed parotid tumor, the facial nerve is not involved. So it is a painless and a slow-growing lobulated tumor without the involvement of the facial nerve. But sometimes this mixed parotid tumor, if it undergoes malignant transformation, if it undergoes malignancy, what can be observed is that initially when the tumor was painless, now if it changes to malignancy, it shows there is occurrence of pain, the tumor is going to rapidly enlarge, there is fixity with hardness, that there is enduration of and hardness can be seen in the gland. And since the mixed parotid tumor, if it was a benign condition, the facial nerve involvement was not there. But once it undergoes malignancy, it involves the involvement of the facial nerve also occurs, and there can be found that the cervical lymph nodes, they are found to be enlarged if there is a malignant transformation of the mixed parotid tumor. Now, next, moving on to the next clinical aspect, it is the parotid calculi. So there are certain conditions in which the parotid gland, the Stensen's duct of it, there is seen that there is a formation of a stone-like mass, or a calculi is formed within the duct of the Stensen's duct of the parotid gland. So this parotid gland, the Stensen's duct is obstructed with the calculi, and it is called as the parotid calculi. And the observation, how to check for it, it is through the injection of a radio-opaque dye in the vestibule of the mouth. Through this, then the vestibule of the mouth, the radio-opaque dye, through the orifice of the duct, the radio-opaque dye is injected, and the location of the calculi can be found out. So the entire procedure of this injection of a radio-opaque dye as to ascertain the real location of the calculi, it is known as the cialogram. And how to palpate this, how to palpate this calculi? So bidigital palpation can be there, or with the help of spatula, the parotid duct can be palpated. Now, moving on to the next applied clinical aspect, it is the Fraze syndrome. Now, mostly what it is seen is whenever there is a parotid surgery. So, during the surgeries of the parotid, what is going to happen is the gland is removed into two parts. Why? Firstly, the superficial part is removed, and then the deep part is removed, just to preserve the facial nerve, so that no injury, no damage to the facial nerve occurs. So this is the reason during the parotidectomy process, the gland is removed in two parts, first the superficial and then the deep part, thereby in an attempt to preserve the facial nerve. Now, sometimes after the parotidectomy, what is seen that there is regeneration of the secretomotor fibers of the auriculotemporal nerve. Now, since after the parotidectomy, in some cases there occurs a regeneration of the secretomotor fibers of the auriculotemporal nerve, which ultimately joins the greater auricular nerve. So that leads to the stimulation of the sweat glands and hyperemia in the area of the distribution of the auriculotemporal nerve. Now, so there is sweating and hyperemia in the area of distribution of the auriculotemporal nerve. So that leads to redness and sweating in the area of the skin supplied by the nerve. So what it is going to happen is, whenever such a person chews, what it is going to happen is it causes an increased sweating in the area of the distribution of the auriculotemporal nerve. There is an increased sweating And sometimes, since it is involving the auricular in the area, what is involved, it is the area of the distribution of the auriculotemporal nerve. That's why it is also known by another name, which is also called as the auriculotemporal nerve syndrome. So the Fraze syndrome has got another name, which is also called as the auriculotemporal nerve syndrome. So students, this was a short discussion. And one thing I missed out, it is the parotidectomy. So as I've already said, that during the surgical removal of the parotid gland is removed into two parts. The cleavage of the gland is done in two parts. Firstly, the superficial part and then the deep part, thereby preserving the branches of the facial nerve. And now what is going to happen is how the nerve is traced out. So the tracing of the nerve is done from behind forwards. So the path as to how the nerve is being traced, it is from behind forward, the nerve is traced, and the parotidectomy procedure is carried out. So students, this was a short discussion about the clinical applied aspects. Just be summarizing it. Firstly, it is the parotid swellings. It is due to the unyielding nature of the parotid fascia. Parotid swellings, they are very, very painful. Next, it is the mumps, which is actually a viral infection, which is going to cause severe pain in young children. It mostly seen. And the mumps virus, it has very strong affinity towards the parotid gland. Next is the parotid abscess. So parotid abscess, there is a retrograde bacterial infection through the Stenson's duct into the parotid gland, and the parotid abscess can get formed. The important thing is that our horizontal incision is given, vertical incision is avoided. Next is the parotidectomy. Next is the mixed parotid tumor, which is a benign condition. Slowly lobulated small lobular mass is there, which can sometimes undergo malignant transformation as well. After that, it is the parotid calculi. A stone can form a stone can form in the duct of the parotid gland, and it is the procedure how it is diagnosed through the help of a radio-opaque dye, which is the cialogram. And last but not the least, it is the Fraze syndrome or the auriculotemporal nerve syndrome. So students, this was a very short discussion about the clinical applied aspects of the parotid glands. These all 6-7 points will help you to these points must be there in your answer to make your answer about the detailed description of the parotid gland complete. Students, if you do have any queries or comments, you're most welcome to comment me in the comment section. And students who are visiting my channel for the first time, and if they haven't subscribed yet, do subscribe my channel, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.